Hi, good morning or good afternoon. Thank you all for joining this webinar. Welcome to the introductory webinar of Medis Ultrasound and the Multi-Modality strain application. I'm Kaylee Ducker, I'm the product manager of MR, but today I will be the moderator of this webinar. We will start off with the strain ultrasound application and we'll gear towards the strain multimodality abilities. If you have any questions during or after the webinar, please feel free to use the Q&A section in the Zoom option. I will try together with David to answer them all, either during the webinar or at the end of the webinar. So please feel free to ask questions at any time. Without further ado, I would like to give the words to David Houteman, our speaker of today, who is the product manager of Ultrasound. David, the floor is yours.
Thanks, Kaylee. Welcome, everybody. Very excited today to be presenting our new ultrasound solution. And to start, I have here a slide with an application running. And perhaps many of you might already are already a bit familiar with this user interface, with this application. Some elements like the feature tracking or the strain quantification on the ultrasound. What probably most of you do not know is that this application that is being found in vendors such as Tomtec and Siemens, you might have been using it, was developed by a company called AMED. And AMED is a company that was founded about 20 years ago in Italy by a very passionate cardiologist, a biomedical engineer, a software engineer, and they founded a company to develop technology for ultrasound post-processing. And last year, Medis acquired this company. Inherited a lot of ultrasound technology that we actually also already have been using for quite some years in our MR and CT applications. So about 1.5 years ago, AMED was acquired by Medis. And to give you an idea of the technology that AMED has developed over the years, here's a timeline. Which is a very full slide because there's a lot of cool things that they did. In 2000, they were founded and started with developing a technology for perfusion imaging in ultrasound images. At the early days, they developed already technology to track features or speckles from ultrasound images. And this resulted in their first product that they integrated with Siemens called VVI, vector velocity imaging. And at the time they did deformation or displacement analysis. Around 2008, they provided their application integrated to the Tomtec solution, which Tomtec called the CPA or the 2D CPA application. And this is a name that might ring a bell with you. Also referred to as speckle tracking in the Tomtec solution or cardiac performance analysis. So this is where strain imaging was provided as a vendor independent solution in the Tomtec system by the company AMED. And around 2016, Medis and AMED started a partnership to develop a solution for MR, for our cardiac MR applications, for strain and quantification based on the feature tracking. Their technology was really very robust so that it can be applied not only on ultrasound, but also on MR. And 3 years later, we also developed a first solution for CT. So it is really a truly modality independent technology that is in the engine for the cardiac deformation analysis and the strain quantification. So over the years, they've developed several applications. Also, our technology can be found in preclinical consoles, such as the system of visual sonics for rodent lab research, or in a solution, for instance, marketed by GE, the Voluson ultrasound console for obstetrics gynecology. So we are very proud that AMED chose to join Medis, and allowing really a multimodality approach towards cardiovascular imaging. And here you can see some of the solution where the technology that we today call QStrain can be found. So in the GE system, the Tomtec, Siemens, Visual Sonics, and much more. And now, 1 month ago, we launched our first Medis ultrasound system. So this year, we launched it as a research application, this technology that is already being used for 20 years. Coming year, it will go for clinical clearance. But already this technology now is available for ultrasound, MR, and CT. For the two latter, MR, CT, it is already clinical. And what you can find in the system is analysis for the left ventricle, for the left atrium, for the right ventricle, and you can even do measurements on the fetus, the unborn baby. And we're introducing also with this launch a modality-independent parameter for regional function analysis. And we call that inward displacement. So very excited to also show you more on that. So with this technology that started development since 2000, it is vendor independent and modality independent, has truly also powered scientific research. There are more than 1,400 papers that you can find if you Google for the 2D CPA, the VVI, etc. That you can see that the former versions of the QStrain Echo app have been used. So it has been really used for all kinds of topics. For instance, strain analysis in the left ventricle, the left atrium, the right ventricle. And all kinds of studies have been done on reproducibility. Normal values have been determined in important society papers. Contrast echo papers, valvular heart disease. There's a lot of work on cardiomyopathies, cardio-oncology, stress echo, etc., etc. And I don't want to make this a very thorough scientific presentation, but I just want to highlight a couple of the papers. For instance, this one, this was already 8 years ago, where they looked at reproducibility of global strain as well as regional strain. And more recent, there have been very important papers from the EACVI group, the NORA study, where they determined reference ranges for the normal left ventricle. And also they have done a paper a year later on the left atrium. And in this, the strain analysis was really powered by the QStrain. Contrast echo is, we can find papers. Here's a paper on amyloid already from 2012. And also very interesting, a paper in the New England Journal of Medicine where they used the software to quantify the strain. So also quite something, quite an achievement. Cardio-oncology is a topic for echocardiography and strain that has been researched. Valvular heart disease, children's heart disease, and even here fetal cardiac deformation is being analyzed by Dr. DeVore and colleagues that work closely with GE to develop methods for measuring the fetal strain. So something that we're quite excited that this technology is now part of the Medis suite also for ultrasound. What we're also excited about is we're introducing some new concepts. And this is the first one that is quite interesting in the software. I will show you in a live demo also in a couple of minutes. And that is just a way to look at global function. without really measuring new parameters, but representing them in a very simple manner. So when you measure the function and the strain from the 2, 3, and the 4 chamber apical views, and whether you do that with ultrasound, MR, CT, it doesn't really matter, but you get a 3D model that deforms over time. And you can measure longitudinal strain, ejection fraction, as well. You can measure the circumferential strain, because we have 6 points in this short axis view. And that has been validated in MR, and we have seen that whether you measure it from the short axis views, the circumferential strain, or the long axis view, it doesn't really matter so much. They compare very well. So this actually allows you, with 3 views and a couple of contours, to have a comprehensive evaluation or characterization of the global function. And we depict that in this graph. And you can see this dot is representing the health of the heart, the global function of the heart. When it is on the left lower corner, everything is fine. If it's on the right upper corner with a reduced GLS, a reduced GCS, and a reduced ejection fraction, we have HFrEF, reduced ejection fraction, heart failure. And in between, you can have this dot moving. And it's quite interesting if you want to follow patients over time, how this dot then can move in such a graph. So this is a nice concept to represent the function of the heart. Another thing that we are introducing with this version now is the inward displacement. And that is because we get questions from you, from the field, to have an objective measurement for regional function. And already regional strain is something we, of course, offer in our ultrasound and MRCT. And in ultrasound, it is used more or less in a qualitative manner in a 17-segment bullseye to see whether you can see patterns. But to do that for MRCT is quite difficult. There is some research, but it is difficult, let alone to do a quantitative measurement to really look at the numbers. And with this new parameter that is really designed for regional function, we can give a very nice objective measurement of regional function that actually matches very nicely what you actually see. So it is very much in line with the visual interpretation to give you an objective confirmation of regional dysfunction. And it's based on the endocardial displacement towards the center line. And we developed a special method for that we have a patent approval pending. And you can see that every point has a different point on the center line where it is contracting to. And that is because of the geometry of the heart. So I'll also show you some examples there. And this helps for regional function and even could have some applications in looking at mechanical dispersion parameters, of course.
But Piet, we received a question for this method.
Sure.
The question is it endo-AP or myocardial strain?
Endocardial strain. So it's based, this method is purely based on the endocardial displacement.
Thank you.
Yeah. Now we have this inward displacement, and we also have an index. And that is a measure, a quantity that allows you to, in a very easy, simple, and immediate manner, see whether the displacement, the inward displacement, is normal or abnormal. On the left, you see the measurement of the inward displacement, and we combine it with region-specific normal values. And we are working on a large cohort, but this is from an initial cohort of 10 healthy male subjects. So we already see a regional variation in the inward displacement values, where in the septum there is less displacement than in the free wall. And if you compare the segments of your subject with this normal, then you get a percentage. If it is 100%, that means that the value for your subject, for the patient, in this segment is the same as the normal value for that segment as obtained from the cohort, the normal cohort. So if it is around 100, a little bit less or above, it's normal. There's always a bit variation. But as it progresses to 0 or even goes negative, then it will represent dyskinesia. This is a very easy way to see whether the regional contraction is normal or abnormal. So with that, I would like to show you a live demo before we continue with the presentation. Let me load.
With that, I would like to take the opportunity actually to start the poll. We are very curious on how you use currently, or if you use currently, strain, and if so, for which modality.
All right, so while you're filling in the poll, I'm going to load a case, and I'll show you from scratch how you can do the strain analysis. So over here, you see the viewer. Those already working with MR, CT, or they already know this viewer well. And I can see here the ultrasound loops. And I'm going to select a 4-chamber, there's 88 images here, a 3-chamber, and I'm going to select a 2-chamber. And I will load that into the QStrain echo application. It's a very similar workflow that you might already know. And then here you can say, even if you have multiple loops, you can still inspect which one you want to load. So I'll just assign now the 3-chamber to the 3-chamber and the 2 to the 2 over here. And the next step will be then to do the contouring, where we have a very nice algorithm where I can use 3 clicks and already get a contour and even modify it a little bit to get it in place. So it's a semi-automated method. And if you accept this, right, you already have the strain based on the 2-chamber view. And as you analyze these loops, like this, they will fill in the bullseye. So you can do strain on a single view, 2 views, or 3 views, as you see fit. We also have this wiggle, this quiver mode. If you have challenging images, maybe for the right ventricle sometimes, moving the image will help you to identify the borders better. And then, yeah, the feature tracking or speckle tracking algorithm is really measuring, yeah, where the pixels are going. And based on that, we can do yeah, the GLS, the GCS, and the ejection fraction. And here you have it all quantified in a single single plot. So this is the strain. We have the regional strain measurement here. We can also do the inward displacement, and it's more or less normal in this case. There are some outliers, but I mean, there can be some variation with echo. And here you see the 3D representation. Also, you can see here the representation of the inward displacement, as you saw just in the slide. All right. So that is a normal subject. I can also do an atrial analysis. So, yeah.
Sorry to interrupt. There is another question coming in. The question is, you did not define in your analysis the region of interest and consequently AP and myostrain. Could you show doing that?
Yeah, I can. We have that. So right now I'm basing everything on the endocardial. But if you're interested in a myocardial or epicardial, definitely we can do that. Then you check this box, endo and AP, and then you can still wiggle this, and then do a measurement to get also the transfer strain. So it's all part of the software. And then in the strain here, you will see that you measure also the transfer strain. And we also have a regional analysis. And here you can choose whether you want to look at curves from an endocardial, a myocardial, or an epicardial point of view. So everything is very flexible in that sense. So I hope that answers your question.
Thank you. In the meanwhile, another came up.
Yeah.
If you only have one of the three apical views and do strain on one of the three, how accurate would then the results be?
Yeah, good question. If you have more data, you can get better results, of course, but the quality of the data has to be good. Sometimes some views you cannot see the wall. If you have a heart that has a more or less concentric shape, then a single view can already be quite nice. But if you have an aneurysm, an infarct, or a not concentric shape deformation, yeah, then limiting only to a single view might not be so representative for the heart. So you have to be careful. But yeah, you have to work with the images that you have, of course. And it's up to you whether you use 1, 2, or 3. It's all very flexible.
Thank you.
All right, let me show you the atrial analysis. Also quite nice. I go in here, so you can also load multiple analysis and run them at the same time. And now I will load this view in the atrium. And here again, we can use this 3-click method, and you can still modify contours also manually if you like. Or maybe you can modify it like this. And then we get these typical atrial function curves with the reservoir, conduit, and the booster pump function. And to quantify these parts, basically you just make sure that your ED and ES markers are in the right place, and then you get the results here. So this is the reservoir, and if you would like to do the booster, I will put these markers over here, etc., etc. So quite easy, quite fast. And let me show you also the RV analysis. Of course, if you take a little bit more time, your contours may be a bit better. I'm doing a very quick demo, but yeah, it's quite robust technology that is tracking the features. So now I'm loading a 4-chamber, and I'm putting it in the RV port. And then here I will show you the manual tracing. So I can just put some dots. And if I'm not sure where to put it, I can use this quiver function, and that gives you a little bit more an idea of where you can find the boundary. So maybe I was a little bit to the outside, and I can make sure that the contours are maybe better like this. Ooh, let me modify it a little bit. Like this. And then I right-click to process for the other face. And then here again, you can use a quiver. Maybe here at the base, I need to put this one a little bit higher. Something like this. And then we have right ventricular function with GLS, of course, fractional area change. We can do the free wall, and we have all these other parameters. So it all works in the same way, and it also works like this a lot for MR and CT. Although with MR, we have very, very powerful deep learning algorithms. So actually, if you want to do a long axis MR left ventricular analysis, basically you don't need to trace contours anymore. I think in 8 or 9 out of 10 cases, it will just be fine to use the machine learning based contours. That is just
an again?
Yeah, sure.
Okay, thank you. We haven't touched upon the left atrial analysis, the question arises, for the left atrial analysis, do we also provide strain rates?
Yes, we do. So we can go here to the regional. And here we can also look at the strain rate. And here you also have an average that you can see. And always also in the outputs that we do strain rates.
Okay.
And we also have that. Yeah, we also have that for the CT and MR, of course.
Yeah, it's for all the same, right?
Yeah.
Then more on the data that we input. There are two questions regarding that. Yeah. One is, can we also perform the analysis in now I need to pronounce it correctly. Cervical echo images.
TE. Yeah, sure. Yeah, no problem.
Okay, thanks. And the other one is, if the image quality is not as good, can the software then define the bad quality images, and will that remove those segments?
Yeah, it's a good question. In echo, often the quality is not so good. So our approach is, I will explain about global and regional approach. Globally, we do a strain based on the length of the contour. That is very robust. Even with poor image quality, you still kind of can get decent, more or less better result than with regional. In regional analysis, this is a big challenge. So if you go to look at regional results, you can, if you like, disregard segments. And you can just take them out if you don't want to report them or don't want to see them. So I think that is just a challenge with echo. And I think the approach for the global strain to use a contour for the whole and not to do an averaging of subsegments is a much more robust and mathematically sound method to do the strain quantification. So I hope that it is answering the question. I can also show you one more thing. We have here 3 periods, and there's an ECG. And one of the questions is, I think, is an ECG mandatory? It's not mandatory, but it's quite useful because then we can identify the RR intervals automatically. But if you don't have an ECG, and also in fetal imaging, it's not always there, we can create the periods ourselves. And you can also say, I'm not interested in everything. I just want to look at the first period. You can also draw this kind of cool M mode to give you an idea, especially when you don't have an ECG. This M mode is very useful to tell you, hey, this is where the ES is, this is where the ED is, and that will help you in the analysis. Let me go back to the endo-based analysis. So then you have these nice curves that can help you to determine. So no, ECG is not mandatory. All right.
And the amount of heartbeats?
I don't know if there's a limit, but if there's really a lot of heartbeats, of course, it might get a bit slower to process it, and you might want to pick a few instead of everything. But it's quite flexible.
Okay, thank you.
Right, cool. Let me move on because I still have a couple of slides I would like to show you. So the technology is modality independent. It works on ultrasound, MR, and CT. We also have some very nice scientific papers on MR, many of them, and also on CT we have quite some nice ones, but I'm not going into that. I just want to show you our latest regional parameter, how that performs on, for instance, CT and MR. And this is a patient that had a more or less normal heart. And what you can see here is then the global function is more or less normal. And also the inward displacement pattern, everything is red. So everything is normal in this CT case. Also in the 3D model, you see everything red in the contraction. I can show you a case of a lateral infarct. Probably you will notice here in the free wall, there's a thinner wall. And you can actually notice in this one that there's a bit of outward motion or outward displacement during the contraction. So using the inward displacement parameter, we can capture that. So here you see that anterolateral wall over here, it's moving outwards. We can capture that with this parameter, and with the strain that people are trying to use regional strain, it's not so easy to do that. And I think that's because the inward displacement is truly designed for objective confirmation of your visual presentation. And here you see also the place of the dyskinesia nicely in the 3D model. Also, it works for MR, and even it works for challenging images. This is a 3 Tesla scan and of an acute myocardial infarction. The feature tracking and the boundaries that were needed in echo, I put them with 3 points. In MR, there you don't have to trace anymore. You let the algorithm, the deep learning algorithm, trace everything for you. It's really a very powerful technology, and then you can also see the problems in the MR. All right. So one more thing, something we don't have. Yeah.
Maybe a good one, or may I ask you to explain again a bit the difference between the inward displacement and strain? There's a question whether it is the same or if it's a synonym.
No, it's different. So what happens with strain is it's relative deformation. So in global strain, it works very, very nicely. We look at the lengths of the contour in end-diastole and in systole, and we look at the relative deformation. So minus 20% would be more or less normal. What happens when we are going to regional strain? We chop the contour up in 7 segments, and all these segments are tied to each other. In echo, it works reasonably well, but in MR and CT, the problem is when you have an outlier with a segmental strain, it affects the other segments. And that makes it very noisy, the strain that you measure. If one segment is pulling too much, that means that the other one will stretch too much. And that is why we get a lot of variation in regional strain in MR and CT. The inward displacement doesn't have this problem. The inward displacement evaluates the tracking points towards the center line. It's not so much influenced by the neighboring segments, or it's not influenced by the neighboring segments. So it's a much better way to quantify regional function. It is not contractility, it's something else. You can think of it as a more surrogate, but it is a very practical and useful approach for regional function. So I hope that also answer.
Thank you for the explanation.
Yeah. All right. All right, let me go to the presentation. Because what we have today is the multi-modality system for strain and advanced cardiac deformation. What we're also doing is we're developing the next generation of parameters for evaluation function. And we really want to go beyond what we have today towards LV physiology derived from imaging, and not using a supercomputer and calculations, but really using a regular off-the-shelf computer. And we have created a method using a mathematical model where we can measure the global hemodynamic force curve. And that is also, again, it works on ultrasound, it will work on MR, and it depending a little bit on the frame rate, but then it, in theory, also works on CT, which we still have to show. And here is a demonstration that I recorded. Basically, when you have this 3D model, over time, all we need to add is dimensions of the valve at maximum inflow for the mitral valvular dimension, which I'm showing you to trace now, and maximum outflow in the aorta during the systole. And then through a sophisticated mathematical model, validated against 4D flow MRI, we can, with a couple of seconds, quantify this hemodynamic force pattern. And from this curve, we can get all kinds of new informations about the function of the heart, systolic, diastolic, and we're currently working on some further publications to and we will for sure organize some new webinars to explain more on this very exciting concept. But that is something that, just to give you a little bit of a glimpse in the future, what we're further developing. All right, so we're coming a bit towards the final part. We're really excited, and because of this, we have an end of the year special promotion for you. And that is that we offer a 50% discount if you order a package that has the ultrasound, or maybe the dedicated ultrasound, or the multi-modality strain package, or you already have a software, the MRCT, and you would like to add the ultrasound. We can offer you a big 50% discount. So very exciting. But this offer will expire at the end of this year. So if you're interested, reach out to your local representative or email sales, and we'll be happy to explain further. So that is what I wanted to show to you. Don't know if there's any further questions.
Yeah, the few more questions came in. Maybe more question in general. This presentation was mainly with regards to the ultrasound strain, but does the system have measurements in the package for other echo measurements like AMED, Doppler, etc.?
Yeah, good question. Not at this moment. We will come out next year with a lot of basic measurements for your day-to-day routine use. So this month we were launching this first version for the advanced deformation. And that will be something to look out for next year.
Thank you. Then I think a feature request. The question is, why is the AI tracking used in CMR only?
Well, you know, we are definitely working in the background to put it into the other modalities as well. But the reason is we started with MR because that is one of our flagship products. And that's why we wanted to do it first in MR.
So will be worked on in the back, but for now it's currently only available in the MR application. Yep. And then the last question, and I am not, well, I think it's regarding the strain in general. Is the tracking anti-diastolic or for any phase?
Well, what I will, maybe I can explain a bit. If I understand the question correctly, what happens is that you define an end-diastolic border and an end-systolic border, and then the feature tracking, the speckle tracking, will find the remaining borders basically. So that is how it works. I hope that answers the question.
Okay, then just another question came in. How many phases are needed for strain or inward displacement in case of CT images?
Good question. We have papers that have used 10 phases on CT to measure strain. That works well. And there's really good data comparing it, also looking at outcome in TAVI patients. So 10 can already be enough for global values. However, if you want to look at parameters like strain rate, or you are more interested in the curve, then 10 is low, and it might not work that well. So For the usual suspects in global function, it works. For the inward displacement, it will also already expected to work. We still have to publish on that. But if it is a strain rate, or if you're looking at parameters for mechanical dispersion, like time to peak, it is difficult, because then we are looking for peak values on a curve, and they will not look that well. You won't be able to find the peak very well on 10 phases only. So it depends a bit on what you want to do.
Okay, thank you. There are 37 answers on the poll. So
cool.
With that, I would like to share the results.
Not everybody answered, but see that. Oh, that's quite interesting. So already quite some people also doing it on CT, but ultrasound definitely the most.
Yes.
Cool. Okay. Are there any further questions?
No, not at this moment.
Okay.
So I think with that, we can conclude this webinar. Thank you indeed all for joining this webinar. I hope that we have been able to answer all your questions. If you still have some remaining, or maybe tomorrow morning you just think of a question, please don't hesitate to contact us at sales@medisimaging.com. I will also share the email address in the chat. If you would like to try out the software yourself, I will also put the link from the website in the chat, so you can request a trial of that. With that, I would like to thank you, David, and all of the people joining. Hope to see you soon and next time.
Thanks. Bye-bye.
Have a good day.